Good morning and good evening to whoever's out there. My name is Mercedes Malak, and I am a senior cellular microbiology major hailing all the way from Maryland. And today, I'm going to tell you all you need to know about lupus. So, lupus is a systematic autoimmune disease that occurs when your body's immune system attacks different organs and tissues inside your body. It commonly attacks your joints, skin, kidney, blood cells, brain, heart, and lungs. It commonly can cause arthritis in many patients that have often had it. So symptoms to know whether or not you have lupus include fatigue, fever, joint pain. You can have a butterfly-shaped rash right here across your face, and that's a very common symptom. You can have skin lesions or different rashes that appear throughout your body. Your fingers and toes can become white or blue when they're exposed to cold. You can have shortness of breath, chest pains, dry eyes, or headaches and confusion, and sometimes memory loss. So the question is, who's at risk of getting lupus and how do you get it? Typically, lupus affects predominantly women. Women are 9 times more likely of getting lupus than men are, and it predominantly affects African American women. African American women, 1 out of 250 are likely to have it, and 1 out of 400 Caucasian women are likely to have it. And symptoms typically start to flare up around childbearing age, so between 15 and 24 is when the common diagnosis for lupus is commonly done. So common complications for women that have lupus can commonly be kidney disease because it often attacks people's kidneys. You can have brain or central nervous problems, so a lot of people commonly with it experience a lot of dizziness, a lot of constant headaches. You can have blood loss or blood vessel issues, lungs, and heart problems. People with lupus are also at more risk for infections, cancer, bone tissue problems, or also more likely to also have pregnancy complications. So, if you think you might have lupus, but you don't know what to do, what kind of tests they're going to run, you most likely will visit your local rheumatologist, and they will do a complete blood count. They will do a full kidney and liver assessment, a urinalysis, and then an anti-nuclear antibody test, ANA. And typically people who test positive for this means that they have more antibodies in their body. And most of the time, those with lupus typically test positive, and those who don't have it test negative. And if you do test positive, your doctor will do a more thorough blood analysis. And then also they'll do a erythrocyte sedimentation test, and that determines how long it takes for your red blood cells to sediment to the bottom of the blood tube. Alright, so what are the possible treatments and how do they treat those that typically have lupus? So typically they can usually use over-the-counter drugs such as naproxen or ibuprofen to treat swelling, inflammation, or different other sores like headache, things like that. And then they also use an anti-malaria drug they find commonly used in malaria. They found that also helps those with lupus. And then they also use corticosteroids, and those help with other things, help with suppressing your immune system, to calm down other things like if you're having heart problems, kidney problems, things like that. One recent study, shown right here, has shown that one recent folic acid was recently approved by the FDA. It's commonly used to treat those with arthritis, but recent research has shown that it has been a great way to help those treat those with lupus, and the study recently just came out on April 7, 2020.
You would think those with lupus would actually have a lower chance of getting COVID-19 because their immune system heightened, and the answer would be no. It's actually they have a higher chance because they're on medications to suppress their immune system, so they have less flare-ups. And this study has shown that many patients have actually had to change their medication regimen so that they have a less chance than they usually would have of getting COVID-19. This study was recently done with 7,061 patients. Thanks for watching and learning a little bit about lupus with me today.